Kind enough to be on board with us again. Of course, it's Wednesdays. And that's Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Ray. How you doing today?
I am doing great, my friend. You?
I'm doing really good. It's great to be back in town. The spring sport kids finally have some nice weather to compete in as they come down the stretch of league tournaments and state tournaments and things like that. And everybody getting nearer to proms and graduations, and so in the high school world, all is well.
That's for sure. What do you have for us today?
Well, I was at a conference of our National American Medical Society for Sports Medicine. All the sports medicine people gather. We were in Arizona, and what a bounce back. Almost 3,000 people were there. I think 2,800 people in Arizona, trying to learn as much as we can after having a year where it was canceled with COVID and then a couple years of virtual. It was a great turnout. And one of the points that they were making a lot that's newer in the last 3 to 5 years in evaluating shoulders. And I move into this area a little bit with a slight bit of trepidation. It's a little technical, but your audience is so darn good. They follow so good, and a lot of the coaches that check in with us know more about injuries these days. So I'm going to go into this area. Is one of the things we really came back from. There were a couple very good lectures about when we are evaluating these shoulder injuries in overhead athletes, in our throwers and our tennis players, our volleyball players. Gosh, I had a pretty significant one before I left in a golfer, one of the best golfers in the state. And so when we're assessing these injuries now, the key that everybody's talking about is what's going on with the shoulder blade. And so the shoulder blade, known as the scapula, the shoulder blade is a triangular bone in the back, in the upper back. And this bone has a lot of muscles that attach to it. And what happens when we get injured, it starts to move abnormally. And so it can really be a key to helping us diagnose things like labral tears, rotator cuff injuries, rotator cuff tears in adults, ball and socket, problems with the ball and socket joint. So they're really honing in on even videotaping the movement patterns, and in our diagnosis, assessing the movement patterns as we put these athletes through different types of range of motion, of lifting their arms overhead or wall push-ups to see what happens to this bone, the scapula. And with all of these imbalances, it's really an eye-opener to see that very frequently the scapula is moving abnormally. And there's many different ways it can move abnormally with these imbalances. It can be too tight. It can be too loose. It can elevate where the scapula, the shoulder blade, elevates too high. It can stick out. We call that winging of the scapula. Or it can, the hardest ones, it can rotate and move in funny patterns that cause pain and weakness. And the problem with this is if it goes undiagnosed, about 40% of these people can risk long-term or future shoulder pain when they get older. So we really do want to pick up on these early on. And again, as I mentioned, it's a lot in our overhead athletes as we're watching this bone move abnormally. And there's 8 different muscles that attach to this bone. So when they're out of balance, we have to figure out, it really becomes kind of a difficult dilemma to try to figure out which ones of the muscls are out of balance or not moving normally. And so to treat it, you really need some sports specialty PT specialists or rehab specialists that have seen this a lot before. A lot of people still assessing the shoulder by looking at it move from in front, but the scapula is what we're learning. The shoulder blade is the key to really good diagnosis. And once they do, they can assess and change and treat this imbalance with different stretching exercises of muscles and strengthening exercises, with a lot of manual therapy or deep tissue massage to get these moving again, with treatments like dry needling that they use to get these muscles relaxed to be moving again. And then once they get it in a proper position, you see a lot of athletes at the higher levels competing on TV or even in high school with the kinesio tape. When we get that scapula in the exact right position we want to be in, we want feedback to the brain that, oh, yeah, that's where that shoulder blade is supposed to be. And so you'll see that real bright tape that we do in sports medicine quite a bit now. And so it's been a little bit of a change, a lot of focus on the shoulder blade, and it really has been helpful to us to understand and diagnose these sooner, more effectively, and get athletes back on the field playing sooner without pain, without weakness. And so it was a big change and very helpful to us that got a chance to talk about this in Arizona.
Wow. And imagine a lot of different feedback from different avenues going forward with this, right? It seems like the world of medicine changes weekly basis.
It does change really, really quickly. And so, again, with this experiential learning of being in the field for so long, as I talk about a lot now in my 35th year of being in the field, it does change rapidly. And that's kind of fun because it's a challenge for you. You know, just when you start to get comfortable with something, Ray, you think, oh, my gosh, now there's new things coming out about how you treat things. Sometimes they're diametrically opposed to the way we used to do it. And so, yes, but it also is a little bit anxiety-provoking because, you know, you really have to keep up on things if you're going to keep stay in the field of medicine. And that's why so many people specialize because, hey, the part that's really interested to me is how do we get athletes well and get them better quicker? It's really hard when you're in general medicine and you have so many different organ systems that you're looking at and things. But you're exactly right. Things in medicine change quickly, and we have to be on our toes. We have to be paying attention, and we have to do the best we can to keep up on these things to help our patients the most.
All right, Joe. Great to have you back, my friend. Sounds like a really good trip to Arizona in so many different ways. Thanks for passing on the information and the insight to us this morning in the world of sports medicine. Always appreciate it, Joe.